This is a 6-week rehabilitation program for a grade 2 ACL tear. Today I'll be guiding you through the recovery process stage by stage. We'll begin with immediate protection and pain management before moving into joint mobility, strength development, agility, and sport-specific training. Finally, we'll discuss a safe return to play. It's important to note that rehabilitation for ACL injuries is not a one-size-fits-all approach. Every individual responds differently, so monitoring pain, swelling, and overall function at each stage is critical. The program I'll present provides a structured timeline, but progression depends on the patient meeting specific goals before moving forward. For this example, I've designed the program with a netball athlete in mind. In the first week immediately after injury, our priorities are to protect the ACL and prevent any further damage. The acronym PRICE is central here: protection, rest, ice, compression, and elevation. These principles reduce swelling and pain, and they allow the knee joint to begin healing. At this stage, the athlete should stop playing immediately after injury and avoid any weight bearing on the affected leg. I recommend crutches. The exercises are deliberately gentle. Patella mobilizations keep the kneecap moving freely, which helps prevent stiffness. Quad sets performed isometrically encourage activation of the quadriceps without stressing the ACL. Straight leg raises build baseline strength in the quads and hip flexors, while heel slides allow gentle bending of the knee up to around 90 degrees. The key progression points in week 1 are being able to activate the quads effectively and tolerate gentle knee flexion. If pain and swelling are all well controlled by the end of this week, the athlete is ready to move on. Rushing this stage is too common. If you push too soon, your swelling can set back your progress. This is how you can strap a grade 2 ACL tear. So to prepare, you should sit or lie down with your knee bent at a 90-degree angle. You position your first piece of tape in I shape right underneath your kneecap without stretching it. Next, you're going to want to slightly straighten your knee a little bit. Get a medium size piece of tape and go from top to bottom on each side of the kneecap, just like it's being demonstrated in this video. And at the very end, you should ensure that all 3 pieces of your tape are secured on both ends. In week 2, the emphasis shifts to regaining joint motion and slight beginning to weight bear. Achieving a full extension of the leg is critical because if extension isn't restored early, it becomes much harder later down the line. Exercises include 5 to 10 minutes on a stationary bike, which is a low impact way to restore motion, provided that you have no pain. Mini squats to about 30 degrees begin to strengthen the quads through a safe range. Calf raises maintain strength in the lower leg, which supports normal walking mechanics. Glute bridges target the posterior chain, which plays a vital role in knee stability. Low step-ups reintroduce functional weight bearing. and you should continue your patella mobilizations. The key goals this week are to start walking normally, manage swelling, and continue to build confidence putting weight through the injured leg. A physiotherapist typically becomes more involved here, helping guide safe progression. At the end of this stage, you should have nearly completely normal walking, minimal swelling, and the confidence to progress to strengthening exercises. Moving into weeks 3 and 4, the focus is on building strength and restoring neuromuscular control. Neuromuscular control means the body's ability to activate the right muscles at the right time, which is critical for knee stability. Exercises here progress significantly. Bodyweight squats now increase to about 60 degrees of knee flexion. Lunges are added to challenge stability and functional strength. Resistance band side steps help activate the glutes, which prevent the knee from collapsing inward. A common problem linked with ACL injuries. Single leg balance drills challenge your stability, helping the brain to relearn how to control the knee. Cardio work can continue with cycling or treadmill walking for about 10 to 15 minutes, provided there is no pain. Step-ups also progress by increasing the step height. At this point, pain-free strengthening is the key marker of success. Athletes may be able to start light jogging, but only if your knee is stable and swelling-free. A common downfall here is the progression to jogging too quickly. You must first demonstrate good strength and balance with control, especially on single leg tasks. In week 5, the program becomes more dynamic. The goals are to improve dynamic control by adding plyometric movements and begin agility work that mimics sports situations. Jump squats develop power and prepare you for explosive movements such as jumping and rebounding in netball. Lateral lunges are there to train strength in the frontal plane, which is critical because many ACL injuries occur with sideways or cutting movements. Single leg Romanian deadlifts improve hamstring and glute strength while also challenging balance. Agility ladder drills reintroduce quick footwork patterns, and shuttle runs begin to challenge acceleration and deceleration. 2 key demands of netball. Side shuffles also target lateral control and conditioning. By this stage, you should be able to complete plyometric and agility drills without pain or swelling. Jogging and running should feel natural, and confidence in movement should be increasing. An important thing to consider here is landing mechanics. You should always focus on soft, controlled landings, avoiding an inward collapse of your knee. Poor landing technique at this stage can increase re-injury risk. Week 6 introduces sport-specific netball drills. The aim is to build both confidence and competence in skills required for a game. Netball footwork drills involve pivoting and cutting, which replicate the movements that often stress the ACL. Acceleration and deceleration sprints simulate real match demands. Jump landings and change of direction are practiced to reinforce safe movement mechanics. Defensive slides mimic defensive play, while small-sided netball drills bring together passing, cutting, and jumping in a controlled environment. At this point, the athlete should achieve full range of motion and experience no pain or swelling after exercise, while also demonstrating confidence in pivoting, landing, and cutting movements. Confidence is a key factor here, not just for your physical recovery, but also your psychological readiness. Athletes recovering from ACL injuries often fear re-injury, so structured and sport-specific drills help overcome that barrier. The final step is transitioning from rehab into full sport participation. This stage depends entirely on medical clearance. The physiotherapist or sports doctor will assess your strength, your stability, and your range of motion for functional performance before giving approval. Return to play involves a gradual reintroduction to full team training, starting with non-contact drills, progressing to contact, and eventually competitive matches. Supportive bracing or strapping, that was introduced earlier, may be used initially to reduce the risk of recurrence. The ultimate goal is equal strength and stability between both legs, injured and uninjured. No pain and full confidence in movement. Importantly, physiotherapy support should not stop here. Ongoing follow-ups reduce the risk of re-injury and ensure you continue to strengthen your knee. To summarize, this 6-week ACL rehab program progresses through protection, joint motion recovery, strength development, dynamic control, and sport-specific training before culminating in a safe return to play. The program emphasizes gradual progression, careful monitoring of symptoms, and ongoing physiotherapy support. The exercises are designed not only to heal the ligament, but also to rebuild the strength, stability, and confidence needed for the high demands of netball. Rehabilitation is as much about building resilience and confidence as it is about physical healing. If you do it correctly, you can return to sports safely while reducing the risk of injury and supporting your long-term knee health. Thank you.